Hello guys, and welcome back to my channel. My name is Pharmacist Oluwafuntoborokini. In this video I'll be talking about menstrual disorders and their treatments. If you're new to this channel, welcome to my channel. I hope you do like this video. If you're a returning subscriber, thank you for coming again. I hope you do like this video as well. If you're yet to subscribe to my channel, please let today be the day when you finally click the subscribe button. Now let's get to it. Menstrual disorders and their treatments. With every menstrual cycle, the uterus lining, that is the endometrium, thickens to accept a pregnancy, to nourish a fetus. So when this does not happen, when fertilization does not occur, what happens is that the uterine lining that was prepared before begins to shed, and that comes out as menstruation. In every menstrual cycle, we have between 26 to 30 days. The average menstrual cycle for a normal woman is 28 days, and the duration of period is between 3 to 7 days, usually 5 days on the average. So when the period begins to deviate from this constant, you should know that there is a problem. So when the menstrual cycle is not the usual 26 to 30 days, or if the duration is not the usual 3 to 7 days, or maybe the period is too light, or is too heavy, or is too painful, then you'll be able to know that okay, there may be a problem somewhere, and that is why we have menstrual disorders. The disorders I'm going to be talking about in this video are premenstrual syndrome, amenorrhea, dysmenorrhea, and menorrhagia. I mean, mentioning some other conditions among these that I have mentioned, but these are majorly the four that I'm going to be talking about. Now let's talk about premenstrual syndrome. Just like the name implies, premenstrual syndrome. So these are syndromes or symptoms that you begin to see even before you get your period. Normally when you get your period, there are some certain symptoms you see that causes discomfort to the body. You have cramps, some may be severe. We may have cramps, we may have joint pain, back pain. You may have difficulty eating much, that is, you may have indigestion or bloating. Some people come up with acne or other skin problems. Some people have psychological symptoms like mood swings and depression. In a case where these symptoms begin to come too early, like even before you get your period, you're already having these symptoms, such person may be diagnosed with premenstrual syndrome. Now, what is amenorrhea? Amenorrhea is the absence of your period for a period of more than 3 months. So first month, second month, third month, you don't see your period. That may be amenorrhea. But you have to rule out other things like pregnancy, because when you're pregnant, you don't get your period. So you need to take a pregnancy test, and if you're not pregnant and you're not getting your period for a period of about 3 months, then you should know that there might be an issue which could be amenorrhea. We have primary amenorrhea and we have secondary amenorrhea. Primary amenorrhea is when a child, or when a girl of about 16 years, a girl that is up to the age of puberty, is still not getting a period. That is primary amenorrhea. Secondary amenorrhea is somebody who has already started seeing their period and they just suddenly stop seeing their period for like a period of 3 months. So this is what amenorrhea is. Now, what is dysmenorrhea? Dysmenorrhea is severe and frequent pain or cramps during menstrual period. Normally menstruation comes with cramps, it comes with pain, but dysmenorrhea is quite severe. This is when the cramps are so painful that the person in question has to be rushed to the hospital or to a healthcare center. It is very painful and distressful, and it will keep occurring at every period that the person gets. So this person may be diagnosed with dysmenorrhea. Now, what is menorrhagia? Menorrhagia is heavy and prolonged menstrual bleeding. Like I said earlier, the normal period is supposed to last for between 3 to 7 days. So when a person begins to get their period for more than 7 days, the person may be suspected to have menorrhagia, especially if the period remains heavy. For example, when people start their period, it usually starts heavy or normal, and towards the end of the period, it gets smaller. But there are some people that from the beginning to the end to the 7th day, they are still seeing a heavy period, extending for even more than 7 days. This person may be diagnosed for menorrhagia. In this category, we also have other disorders like polymenorrhea, which is too frequent periods, like maybe having a cycle that is very short. Then oligomenorrhea, which is very light or infrequent menstrual cycles. We have menorrhagia, which is bleeding in between periods, like infrequent and irregular bleedings in between period. This can also be referred to as spotting, like in between periods, and it's happening often. Then we have postmenopausal bleeding, which is bleeding that occurs after a woman has reached menopause. She has already had her last menstrual period, and then later she's still seeing some bleeding. That is postmenopausal bleeding. All these are menstrual disorders as well. Now let's look at the causes of these various disorders I have talked about.
What is the cause of pre-menstrual syndrome? What is the cause of amenorrhea, dysmenorrhea, menorrhagia, and these other ones that I have talked about?
Some of the causes include hormonal imbalance, which is usually the number one suspected cause of these various menstrual disorders. Most people that come up with menstrual disorders are made to take hormonal profile tests in order to check if there is an imbalance in their hormones. Another reason is stress. Some people do come up with various menstrual disorders whenever they are faced with a lot of stressful situations, or they are just generally stressed in their daily living, their activities of daily living. So when people come up with menstrual problems, usually they are advised to take time to sleep, take time to rest. Some are diet induced. Examples of dietary changes is some people are advised to choose complex carbohydrates rather than simple carbohydrates which contain more sugar. They are advised to do more of complex carbohydrates like fibers, fibers rather than sugars. Incorporate fruits, vegetables, and whole grains. A lot of people are also advised to avoid alcohol or caffeine. So you see that people that smoke, consume a lot of alcohol, a lot of caffeine, are also prone to menstrual disorders. So this should be exempted from the diet to get good results. Another measure is exercise. People that have a lot of menstrual disorders are advised to exercise a lot, mostly daily.
So 3 things: you're advised to exercise, you're advised to improve your diet, and you're advised to get enough sleep.
What are the treatments of premenstrual syndrome? Now, the best way to treat premenstrual syndrome, apart from exercise, diet, and rest, is to get good vitamin supplements and good herbal remedies for this purpose. Calcium, magnesium, vitamin E, and vitamin B6 have been reported to soothe symptoms. So you can get supplements containing. It's better to start using this supplement days before you get your period. Let's say about day 14 of your menstrual cycle, you could start taking the supplements in preparation for the period. We also have supplements, like you can call them herbal supplements, like evening primrose oil, ginkgo, ginger, chasteberry, and the likes. They come in encapsulated forms. You can walk to any pharmacy out there and just ask for these supplements and start using them early enough in the cycle, like on the 12th 14th day of cycle. You can start taking these supplements, and they may actually prevent premenstrual syndrome from occurring at all or reduce these symptoms. Now to the treatment of amenorrhea. In the case of amenorrhea, which is absence of period for about 3 months in somebody who has already started seeing their period before, you'll be asked to take some tests, most probably. Tests like pregnancy test, ovary function test, thyroid function test, prolactin test, and male hormone test. So these tests will be able to indicate whether there is an issue with maybe the thyroid gland, or maybe it could be the ovary, or anything could cause it. You will do a hormonal profile test to show the levels of hormones in the body, the FSH, the estrogen level, just so to know whether you are having hormonal imbalance, and that is the reason, or there's an issue with the hormones, that is the reason why there is a cessation in the menstruation. Usually menstruation occurs as a result of hormones in the body. Without the necessary hormones doing what they ought to do, menstruation will definitely not occur. So when there's an issue with the menstrual cycle, it usually indicates an issue with the hormones. So every factor will be checked out, especially the hormones, just to know whether there is an issue. So you carry out tests to find this out. So for amenorrhea, hormonal drugs are commonly prescribed. We can prescribe progesterone and estrogen, just hormones to correct the hormonal imbalance or the problem with the hormones that are causing this issue. We have different examples of hormonal drugs, like we have drugs like Tufastone, we have drugs like Premolute. These are brand names for different progesterone drugs that are administered for people with hormonal imbalance. Now for the treatment of dysmenorrhea, which is very painful period, we have the use of pain relievers like ibuprofen, naproxen, and the likes. These are non-steroidal anti-inflammatory drugs. These drugs will help with the very painful period you get when you have dysmenorrhea. In some cases of very painful periods, hormonal birth control pills are prescribed in order to prevent ovulation, which will eventually reduce the severity of the menstrual cramps. Another solution is surgery, and surgery is only indicated when there is another secondary cause to the dysmenorrhea, to the painful periods. Sometimes when tests are carried out on a person with dysmenorrhea, it may be discovered that the cause of the dysmenorrhea may be fibroids or endometriosis, such issues with the reproductive system. In this case, surgery will need to be carried out to stop this pain, because until when the cause is removed, the pain will continue. And we have some lifestyle and home remedies to dysmenorrhea, which includes regular exercise, reducing stress, and using heat. You may use heat pads on the area, on the lower abdomen, or soaking in hot baths. Heat is usually good for menstrual cramps, it reduces the pain. Another approach is to try dietary supplements like vitamin E, calcium, magnesium, vitamin B1, B6, omega-3 fatty acids. Supplements that contain this have shown to reduce menstrual cramps, so you can also try that. Some dietary measures may also help, like during menstrual cramps, it's usually advisable to take hot drinks. Like I said, heat helps the pain. So apart from using heat pads, you may also try hot drinks. Now to the treatment of menorrhagia, which is heavy and prolonged menstrual bleeding. We have the use of NSAIDs, that is ibuprofen and the likes that I mentioned earlier. We have the use of tranexamic acid, which is used to stop the bleeding. We have the use of oral contraceptives, like I explained earlier, could also stop the bleeding. We also have the use of methods like IUD insertion. IUD insertion has been known to prevent heavy and prolonged bleeding as well. But this is for somebody who is no longer interested in getting pregnant, because this is a contraceptive. So somebody who is going for an oral contraceptive or an IUD will not be able to get pregnant. The IUD releases a type of progestin called levonorgestrel, which causes the uterine lining to be thin, which in turn reduces menstrual blood and menstrual cramps. We also have the hormonal drugs, that is oral progesterone, like the examples I mentioned earlier, hydroxyprogesterone, dydrogesterone, and the likes, that is oral progesterone. One thing you must note is that many of these menstrual disorders may indicate a more serious underlying condition like endometriosis, polycystic ovarian syndrome, fibroids, ectopic pregnancies, and the likes. So when you experience menstrual disorders, it is better to visit the hospital and see a physician so that necessary tests can be carried out on you to find out if these are the cases. If it turns out to be any of these underlying conditions, from ultrasound, MRI, other scans that may be carried out,
You'll be placed on treatment for the underlying cause. And when the underlying cause is removed, definitely you'll be fine. If not, if it's an hormone imbalance from your hormonal profile test, then you'll be given hormonal drugs to treat this hormonal imbalance. And if it is your lifestyle change, like I said earlier, it could be stress or something else in the environment. If it is any of this, from what you have told the physician or from various symptoms that you have shown, it will be discovered and you will also be told what to do. And apart from any of this, I've talked about the lifestyle medications, your diet. I said include whole grains, fruits and vegetables in your diet. And to treat specific symptoms as well, maybe for people who get bloating as premenstrual syndrome, you will be asked to take more water, you'll be asked to eat more slowly, eat little quantity of food daily. For people that have inflammations, you'll be told to modify their diet according to that condition. These conditions are treated according to the symptoms that you have.
I hope that I've been able to shed light on the topic menstrual disorders. I hope from this video you've been able to understand what premenstrual syndrome is and how to treat it or how to manage it, and what amenorrhea, dysmenorrhea, menorrhagia is. Please, if you do have any question about this topic. If there is anything I have not shed light on, or you want me to shed light on in my subsequent videos, please put it down in the comment section below. If you have learned something from this video, please do give this video a thumbs up right about now. Just click on the like button or thumbs up below, and if you're yet to subscribe to my channel, please do subscribe to my channel, and I'll see you guys on the next one. Thank you. Bye guys. Bye.